session, we are going to continue the discussion of concept of illness. We have already studied the definition of illness. We have already seen the two different category of variables, that is the internal and external variables, and how it is affecting the illness behavior. The next we have learned regarding the stages of illness behavior. So we have seen there basically we can divide it into 5 different stages. So stage 1, that is basically presence of the symptoms, when the person is start recognize that they are having certain symptoms related to some pathological changes. In the next stage we have seen they're able to assume their sick role. The third is contact with the medical care. The fourth is dependency, or the fifth is the rehabilitative and the recovery stage. So I hope till here you understood how once the disease process is affecting an individual, what will be the stages of illness he or she will be going through. Now, this pathological process which is present, it will be definitely have a huge impact on individual. So definitely now we are going to discuss about the impact of illness here. So if we talk about the impact of illness, we are going to see the illness can impact on an individual person or on a patient who is suffering from the disease process. And secondly, the impact of illness also can be on the family and the caregiver. So it's not only the client or the individual who is diagnosed with the disease suffers, but also along with him or along with her, their family member and caregiver also suffers from many of the challenges throughout this illness process. So here we're going to learn about what are the impacts can be there of the illness on a particular individual and their family and caregiver. Now, as a medical professional, basically as a nurse, here we need to definitely know about the impact so that we can understand and empathize the client and their family member in the actual manner, and we can provide the supportive measures to them so that they can cope up with the changes and can be able to adjust with the environmental changes throughout the illness process. So first here we are going to read about the impact of illness, because of what we are going to see there will be many emotional responses. So here first we are going to read about what are the different emotional responses will be present as a part of the illness behavior or as an effect of the illness. So basically the emotion is a bodily state which involves the feelings of a particular individual which may develop due to conscious or unconscious motivation. Now, how the emotion are expressed or how the emotion are experienced by a particular individual, that definitely depends. That definitely depends on their perception, situation, personality, and also the presence or availability of social support and different resources. So I hope you get to know the emotional responses of the individual. As we have studied, the illness behavior definitely depends on different variables. So these are the variables which also decide how a person would be emotionally reacting towards the illness process. Now, as a nurse, we should definitely know about each of the emotional responses that are generally seen among the client who is suffering from a particular disease process. So here, if we read about these emotional responses in details, we will be able to recognize the emotional responses of a client in a clinical setup, as well as we will be able to provide the resources so that they can express the emotion in a proper manner, and we also will be able to empathize the individual and can provide them the necessary elements which they require to meet the emotional need throughout the disease process. Now we are going to read few of the common emotional responses that are commonly seen among the individual person who are suffering from a disease process. Now the common emotional responses towards illness include the fear. The next one being the overdependence or the feeling of hopelessness or helplessness. The third being is the anxiety. The fourth one is the hope of an individual. The fifth one is the anger and hostility. So I hope you understood that different emotional responses can be present. Now it definitely depends on the client's perception towards the health, illness and wellness, also the nature of disease condition and the social support and social resources availability. So we're going to see majority of the client will be having fear and anxiety towards this nature of disease, right? So they will basically be anxious regarding the disease process that have affected them. They will be also anxious regarding their future outcome, and they will be also anxious regarding the treatment which is needed, their complexity and the economical and social burden they are going to suffer from. So here as a nurse, we have a very great role to minimize the fear and anxiety of an individual being. So even if your client is present with this fear and anxiety, the most easy way to minimize this two emotional response is to provide adequate information regarding the disease process. Most of the client will not be having sufficient information and knowledge about the disease process, about the nature of the disease and their prognosis. So here as a nurse, we play a very important role to provide necessary information to the client. Here we will also provide education, or we will be providing enough knowledge to the client as well as their family member so that they can understand the nature of disease, they can understand the rationale behind the treatment plan or the treatment procedures, so that they will be also gaining confidence on the medical professionals who are treating them, and they will be also having a positive outlook towards the outcome of this treatment procedure. Next, we are going to see almost all clients will be showing overdependence or feeling of hopelessness or helplessness. As a nurse, we definitely should make them understand that they are self-sufficient even though they're suffering from an illness. And here, we will be the one who will be boosting their emotional strength so that they can perform their daily activity of living on their own. Now, reducing the over-dependency helps an individual client to improve their confidence so that they can have the strength to fight against the disease process, as well as providing support at this right moment helps an individual to cope up and to adjust with the changes that is occurring because of the pathological process. Now, next one is anger and hostility. Majority of the client will show anger. Basically here, the client will be showing the anger and hostility due to the unconscious fear and anxiety about their health. So that is the reason as a nurse here, we should basically assess the need of the client here, and we should provide all the necessary resources to the client so that they will be reducing or minimizing the feeling of fear and anxiety, and as well as providing adequate counseling and psychological support, reduce the feeling of anger and hostility. So that's how basically we are going to manage the emotional responses of an individual as a nurse. Now, I hope you are understanding now why we need to definitely read about the impact of illness, because if we are understanding the illness process is causing the development of all these emotional responses, then only we will be able to provide adequate support to the client in a clinical setup. So, as we are learning it in theory, when you are going to go to a practical field, you will be able to implement all these necessary steps when dealing with a client who are suffering from acute or chronic illness. Now, there will be behavioral and emotional changes as we have studied. So, as a nurse, we should not be judging the client who are reacting in such a typical way towards the illness process. As a nurse, we should empathize them. We should understand that what they are going through. Now, while a nurse is working in a clinical field, we are the responsible person who will be basically assessing the client and their need, and will be providing the necessary emotional support to the client and to the family member so that they can manage with their emotional responses. Now, majority of the cases, if the persons are suffering from severe illness, definitely they need more extensive psychological support. So here we play a very vital role to manage the client with their emotional responses towards the illness. Now, the second we are going to discuss about the impact on family role. So here, majority of the cases we are going to see an individual client who is suffering from the particular disease process may have a disturbed family role. So, for example, if a client is a mother, for example, suppose she is suffering from common cold. Now she is having two children. So here, as the disease process is not so complicated and it is easily managed and treated, definitely their anxiety level will be lesser than a mother who is suffering from a chronic illness like. So what I mean to say basically here is, depends on the severity of the illness, the client will be having or getting impacted on their family role as well. That's the reason here nurses play a very vital role to assess the need and the status of the disease process. Also, we are the responsible person who will be discussing the actual nature of the disease and the rationale behind the treatment procedure that are going to be planned. We will also ensure that the client may perform certain amount of role and responsibilities towards the family, but the majority of the cases we should understand and we should encourage the client to understand the nature of the disease and the importance to not to carry out the role and responsibility towards the family here. So most of the client, if their family role is getting impacted, they will be suffering from a particular problem that they will be having lower self-esteem. So here we will be basically encourage the client to boost their self-esteem so that they can fight against the disease process, and we will be also helping the client to rationalize their inability to perform the role and responsibility towards their family. So I hope till here you understood how it is going to impact the family role. The next impact we're going to study on the body image. So the reaction of the client and the family member towards the impact on the body image basically depends on the type of changes that has been occurred, their adaptive capacity or adjustment power, and the rate at which the changes is taking place. Now, for example, if a client, suppose she is a victim of burn or severe burn, Their body image will be disturbed for a prolonged time, right? Even in some cases, we won't be able to recover their previous body image. Now, here the client will be most likely to suffer from chronic depression, anxiety. They will be having lower self-esteem. Here as a nurse, we should definitely will be providing adequate emotional and psychological support. We will encourage the client to focus on their other aspect of their life, and also we will be providing them the rehabilitative care so that they can improve the quality of life even after victimized with severe burn. So I hope you are understanding now. Definitely, the impact on body image can cause the development of anxiety or depression or very severe emotional responses. As a nurse, we should be in a position where we will be able to taking care of the patient, and we will be able to provide enough resources and information so that we can encourage the client to focus on the other aspect of life and to improve the quality of life of them. So that's how we will be basically counseling, and we will be basically providing the support towards the client, not only to the client, also to their family members as well. Impact on self concept. This is the next factor that often happens with the patient or the client who is suffering from a particular disease. They will basically lose their self concept, that is how we feel about ourselves, that will be getting disturbed once a client is suffering from a particular disease. Majority of the client who is suffering from a chronic illness, they will be more likely to develop this hopelessness and helplessness because of the disturbed self image. So, as a nurse, we should help the client in this stage to identify their strength and weaknesses, and we also will be encouraging the client to work towards their strengths so that they can improve their quality of life at the end. Even if there is impact is present over the self concept, the client will be having difficulty to manage their role and responsibility within the family. That's the reason, as a nurse here, we will be assessing the client's self concept when they are suffering from a chronic illness. We will be also assessing the family members' need and their perception regarding the particular individual who is suffering from a chronic disease. Definitely, as a nurse here, we will be assisting them to cope up with the changes, and we will be assisting them to adjust with the changes which has been taking place due to the disease process. Now, the next topic is the impact on family dynamics. The term family dynamics basically suggests the process through which a family function all together, make decisions, give support to the other family members, and adjust with the changes and the challenges. Majority of the cases, if an individual is suffering from a chronic illness, their family dynamics is more likely to get disturbed. We also will be able to see if a head of the family is affected by a disease, that particular family will be definitely on more need in order to function properly. As a nurse, if we are providing the client to the support, here we should definitely assess the need of the family too. Here we are the responsible person who will be basically communicating towards the family member and with the client, and we will be also helping them to cope up with the necessary changes, and we will also help them to adjust with the challenges and the need that are coming through the way. Often family counseling here is suggested so that they can encourage the family to function properly, and also they can boost the family's bonding so that they can provide adequate support to the client who is suffering from a disease and who are at need. So I hope till here you are completely understood the different impact of illness that can affect the emotional state of an individual. It can affect the family dynamic and family function. It can also impact the self-image, the self-esteem, and as well as the family role. Here, as a nurse, depending on the client's need, we should select necessary intervention. While selecting the intervention, we should definitely prioritize the need of a client. Majority of the cases, we even need to provide support to the family members as well as to the client. That's the reason why we should definitely assess the impact that basically has been taken place within the family and that has been considered one of the most important factor when we are dealing with a patient, basically the patient who is suffering from a chronic illness. That's how basically we will be getting the idea regarding illness and behavior, and also we will be able to understand what is the impact of the illness for a particular individual and towards their family. So I hope till here you are completely understood the concept of illness. We have studied regarding what is illness. We have studied about the variables that can affect the illness behavior for a particular individual being. We have studied regarding the stages of illness. We have also studied about the impact of illness on individual. Now, as we have understood the concept of illness, now we should definitely read certain terminologies associated with illness which are often will be used in clinical setup. So first terminology is acute illness. So here, first we are going to discuss regarding the acute illness. So any acute illness basically suggests a particular type of illness which develops quickly, which can be intense or severe, but it definitely lasts for a shorter period of time. For example, a mild fever due to a mild infection, mild traumatic injury, and mild fracture. Now, often for an acute illness, the clinical course is less than 1 month. Now, we are going to see acute illness usually will be responding towards medical therapies. It's not more likely to get a surgical therapy or need a surgical therapy to manage. Even if it is needed, the recovery rate here will be high. So often the acute illness will be managed with the necessary medical and surgical treatment within a shorter period of time. The client will be completely returned to the pre-morbid state. So once the client is reaching to the pre-morbid states, the client will be completely healthy. So I hope you understood that this particular condition, where if a person is diagnosed with an illness which is acute, is basically will be having a very shorter period of duration. It will be easily managed with a medical or surgical treatment. It doesn't need any rehabilitative support. So we are going to see the client will be achieving early recovery and there will not be presence of any effect of the disease for a lifetime. So acute illness is not as severe as the other illnesses. Also, we have learned regarding the example of the acute illness, right? So any mild disease like a mild fever due to a mild infection, or maybe a mild fracture, or maybe a mild traumatic injury which doesn't have any great impact on the physiological process or not causing a great pathological changes, is considered as the acute illness. Next, we are going to read about the next terminology that is usually used in the clinical practice is known as the chronic illness. Now, chronic illness is basically suggests a condition or a state of disease which lasts for a prolonged period of time and usually cannot be cured completely. Although some illnesses here also can be controlled and managed with necessary lifestyle modification, medical and surgical treatment. For example, diabetes mellitus, heart diseases, arthritis, kidney diseases, and acute immunodeficiency syndrome or infection associated with human immunodeficiency viruses, right? So these are all the example of chronic illness where we are going to see if a client is all diagnosed or developed once with this disease, they need a continuous monitoring, a continuous adherence to the lifestyle modification, the medical regimen, what is generally prescribed to them. Now, these are the kind of illness which will not be managed or cured completely. That's the reason it definitely needs a prolonged period time to manage, and the client will have to stick on to the necessary management in order to get the recovery and in order to improve and maintain their quality of life. So I hope you understood the basic difference between the acute illness and chronic illness. Now we have seen the acute illness, if it is present for a duration of 1 month, we are calling it as acute illness, whereas the chronic illness will be called when a person is suffering from a particular disease condition for more than 6 months, right? So I hope you got the concept that acute illness are those which are present for a short duration of time and it can be completely cured, whereas the chronic illness will be present for a longer duration of time. It may not be or may be cured completely. Majority of the type of chronic illness will be having the some or the other effect within the individual. Now, for example, as I've mentioned, if a person is suffering from diabetes mellitus, now if it is more than 6 months, definitely the client is considered as present with chronic illness, right? Now, once the client is adhering to the medical regimen, they have to follow the medical regimen and the lifestyle modification or necessary changes lifelong. If they're once discontinuing, maybe the client again develop with the signs and symptoms related to diabetes mellitus. That's the reason why we need a continuous treatment procedure in order to maintain the quality of life for individual when suffering from chronic illness. So I hope you are now completely clear about the terminology of acute illness and chronic illness. These are the very usually used term in medical surgical nursing and in clinical setup. There's a reason you should have a very clear idea regarding these two particular terminologies. Next, we are going to read about the third terminologies that is known as the terminal illness. Now, terminal illness is a type of illness from which there is no expectation of recovery is present. Even after managing with certain medical or surgical therapy, there would be no expectation for the recovery of the client. This type of illness is known as the terminal illness. Now, the terminal, it definitely means the concrete expectancy of death. Generally, if a client is suffering from a such type of disease condition, even after providing adequate medical and surgical treatment, the client is not able to manage, then we are going to call it as terminal illness. For example, if a client is suffering from a third stage lung cancer, for say, definitely it is known as, or it is called as terminal illness, because although we are providing or administering chemotherapy, radiation therapy, it is noted that the client may not be able to survive for a longer time because of the complexity of the disease process. This is how certain disease condition where a person, if they're suffering from it, have no exact expectancy for living or have a concrete expectation for death, we're going to call that particular type of illness as terminal illness. So I hope till here you are completely clear about these three different terminology associated with illness, that is the acute, chronic and terminal illness. So I hope throughout the whole session you completely got the idea regarding different concept of illness. I hope you have enjoyed this too. So thank you so much for attending the session. We will be meeting you guys to the next one.